been so many times where I've been in charge and a computer or something's not working, and I'll call IT on a weekend to come and fix it, and it'll be like a loose, like something
Like
just
a
wasn't
loose
plugged in.
cable?
Yes. And then I'm like, oh, you're welcome for like that $500 like weekend overtime pay. You're welcome. You're welcome. Like, I didn't have time to do it. I was too busy saving her life and making a difference.
I was doing chest compressions.
Sorry.
I'm sorry I didn't check the cord.
I didn't have a free hand.
hate IT.
I hate IT. And it's not.
I'm
and
sorry,
it's-
IT.
Yeah, sorry for
If
all
anyone
of you
out there is
IT.
an RT and wants to go into nursing, I think you should.
You
Because
should-
IT is a terrible
'cause-
job.
Well, and it's so. I want them to follow me around for a day. And like when they come up and they're like, how come you didn't turn this on and turn it back off again? I'll be like, why don't you follow me around and I'll show you why? Because there's some other things going on right now. Mr. IT.
Mr. IT man.
Yeah.
Also, thank you for coming.
Yeah. Also, thank you, Derek,
Fixing
for
that.
coming and helping me figure out my computer. Because I don't know.
What do you think is your least favorite part of nursing?
My least favorite part of nursing.
On a daily basis.
On a
Let's
daily
start daily
basis.
and then we can go broader.
Let's see. I think IT.
That's what I was going to say.
That's my least favorite part of nursing. When like you have 20 things to do and your computer won't work. So now we do these like safety checks with medications where we'll scan the patient's wristband to make sure it's them, and then we'll scan the medication to make sure it's really ordered, and then before we put it in their body. And I will, like, if the scanner isn't working and I just need to give them a Tylenol, just like, and then you find yourself like walking out of the room and you're like all sweaty and it's like over Tylenol. Like,
Well,
why?
and it's funny because you could do it like a true emergent, baby's dying, crash to the OR, cut the baby out, everyone, save lives. But the thing that will get me the most riled up, like the most where I want to walk off my job is if something won't scan or a pump won't work.
It's just like
I'm out.
beeping and you're like, or like when the pump says that there's air in the line and there's no air in the
never
line.
air in the
There's
line.
never air in the line. And if there is any air in the line, that amount of air in the line is not going to kill them. So just let it through. Like, oh my gosh.
I can tell that's a really...
No, it's fine. I'm fine. I'm not upset. You're upset. I'm not sweaty. You're sweaty. Oh,
Bring it down.
sorry.
Okay.
Excuse
Are
me.
you okay?
I'm fine.
Me
Are you
too.
okay?
I'm fine. I just don't want to think about anything.
I don't want to think about IT anymore, Erica. It's the bane of my existence.
I know. If we could go back to like no charting,
No gloves.
no
No charting,
no
no
computers,
gloves, no problem.
no beeping machines,
No beeping machines. Probably
just
more
front
moaning.
lines, World War II, legs cut off, stop the
Exploded.
bleeding. That's my kind.
Yeah.
I love it.
Yeah. Stop the bleeding, move on.
Mhm.
No.
What is your favorite thing about nursing?
My favorite part about nursing. I think I say this in jest a lot, but I really think it's true, is saving lives and making a difference. Like there is no better feeling than like when you've like dumped like all the blood products that the blood bank has to offer into this patient, and then like a couple of days later they like walk past your desk and you're like,
Mhm.
whoa, hey,
I saw you and you were dead.
Oh my God, you were dying.
Look at you walking
like,
around.
like a second ago.
You look great.
You look
Oh
amazing.
my gosh,
Have
your
you had
cheeks
work
are all
done? Yes.
All that blood I put into you really did the trick. You look awesome.
2 thumbs up.
Yeah.
10 out of 10 would
How
recommend.
you feeling? Great? Great.
It's the best mask anyone ever put on.
I love it when nobody can get the IV and you like run in and you just dart it and it's in and beautiful, and then you run in the blood and you just feel like, I did that. That was close. I'm really glad that worked.
Or like when a really esteemed doctor will walk by. Like the other day I had one of the anesthesiologists walk by, and it was like days later, and she was like, Jordan, really great job on that IV on that really low blood pressure patient the other day. And I was like, you're welcome. You're welcome. I did that. You're right. I'm so good at that. I'm doing amazing.
No. I
Oh.
would say my favorite thing, which is along the lines of the saving lives thing, is I love emergencies. I love that adrenaline rush. I love
Mhm.
knowing what to do. I love sounding the alarm, getting your team back there, well-oiled machine, and like making that happen. And I know that it's terrifying for anyone who's not doing that on a daily basis. The patient's terrified, but it's just like that rush. I love it until it's like the eighth one, and then I'm just
And
annoyed.
then I'm just tired. I'm just
Like another
exhausted.
one.
Another one. Another life saved. Okay.